Good morning, everyone. Can you hear me okay? Hi, I'm Kim Beauregard. I'm the President and CEO of Intercommunity Healthcare. We are a community health center located throughout the Hartford area. We're currently at our Coventry Street locations, where we house many of our residential and detoxification programs. We want to thank the Governor today and Commissioner Giutani for being here, helping us to convene today's event, and other elected officials that are here and may join us as we continue today. I certainly want to first begin by acknowledging the great efforts that our Governor and the Department of Public Health have taken in order to communicate about this important topic on monkeypox. That work has included updates on websites for creating PSAs and making information readily available for Connecticut residents. As we know from the past several years, strong communication is paramount, given that we are still learning about this virus. As we have been hearing in the news, monkeypox cases are growing rapidly. It's important, though, that we do not overreact, but that we also prepare and take the appropriate steps. To that end, Intercommunity Healthcare is proud to be supporting and partnering, as always, with the state on this initiative, just as we have done similarly through the COVID pandemic. In this effort, we will be a distributor of the monkeypox vaccine. We expect to receive doses beginning next week. Importantly, we want to remind patients that they cannot walk into sites where there's vaccines, especially for intercommunity currently. You must receive a referral from DPH. However, you can also call our main number and you will be triaged and screened. Thank you again. And at this point, I would like to turn it over to the Commissioner of Public Health, Commissioner Giutani.
Good morning, everybody. So we've seen over the last many weeks how this infection has expanded its scope and started to affect the citizens of Connecticut. We know that on July 5th, we identified our first case. And to date so far, we have identified 28 cases. All cases so far to date have been in men, and almost all identify as LGBTQ+. The median age has been 36 years old for patients so far. Most are aged 20 to 49. What I do want to make clear, though, is that anybody who has skin-to-skin contact with somebody who has had monkeypox could potentially get monkeypox. This is not primarily a respiratory disease. It is one that, with prolonged face-to-face contact with somebody, is possible, but it is primarily transmitted by skin-to-skin. What we've seen so far is that there have been no fatalities in the United States. There have been no healthcare workers that have gotten monkeypox from an exposure to date. And there's been nobody on an airplane who's been exposed to somebody who had monkeypox who's been infected. These are promising signs, at least in terms of being able to follow and be able to identify cases and then be able to take care of people appropriately. What we're really here to also highlight today is that we are moving forward with our ability to vaccinate as many people as possible. We were identified on July 8th as a site that was going to first receive our first allocation of vaccines. And by July 22nd, we were able to have all doses that were available to us delivered to the state. We've spent this past week being able to firm up our partnerships, just like we have here today, with 15 sites across the state that are going to be serving as primary vaccinator sites for people that might be at high risk of exposure. We will build that capacity as we see need. We have 800 doses that will be going out to people across the state starting Monday, and every single day we will ramp that up as much as possible and as the capacity of clinics allows, and we will expand our clinic capacity in this week as well as we're seeing what the demand is in the community. Our goal is to try to get as many people that could be high risk for this disease to be covered by this vaccine as quickly as possible. We are anticipating that we may be able to get more access to federal funds to be able to enhance this response even further. And as we've heard that the federal government is getting more vaccines available, we will get an additional allocation as part of that as well here in Connecticut. As we get notified of doses, we will be making sure to push that out. We reassess this every single day, and our goal is to keep the people of Connecticut safe. So with that, I will turn it back over to Kim. Thank you.
Thank you. Thank you so much, Commissioner. I now would like to introduce to you Linda Estabrook from the Hartford Gay and Lesbian Health Collaborative.
Good morning, everyone. My name is Linda Estabrook. I'm the Executive Director of the Hartford Gay and Lesbian Health Collective. The Health Collective has been a provider of medical and dental services to the LGBTQ community and individuals living with HIV and AIDS since 1983. I'm here today with Patrick Dunn. Patrick is the Executive Director of the New Haven Pride Center and Chair of the statewide LGBTQ Health and Human Services Network. I appreciate the attention monkeypox, hopefully soon to be renamed by the World Health Organization, is getting from the state of Connecticut Public Health and Governor's Office. The population most affected now is men who have sex with men, also known as MSM. This population includes individuals who identify as gay and bisexual and those who don't. It takes all of us, government, nonprofit healthcare providers, and community organizations, and individuals in the community to attack monkeypox from all directions. We need to continue to respond to current and evolving circumstances. We all need to play a role in sharing information as widely as possible. And we all need to play a role to stop the ugliness of stigma and shame and name-calling that already has been happening, especially so that it doesn't escalate. The statewide network has been at the forefront of working with the Department of Public Health to provide information and technical assistance to help them in their efforts to adapt to the state's response to this outbreak. The network will continue in this role as long as needed. Having improved access to post-exposure prophylaxis, PEP, in the form of the Jynneos vaccine is important. A vaccine after a possible exposure helps, but it is not a quick fix or a cure-all. Individuals at risk need to continue to pay attention to prevention methods to keep from getting exposed or getting monkeypox. As the commissioner said, skin to skin. These include refraining from intimate physical activities with others if you've had or suspect an exposure, or have unexplained symptoms such as sores or a rash or swollen lymph nodes. You can visit hdlhc.org/monkeypox for more information. Thank you again to the governor and commissioner. And Patrick, did you want to say a few words?
Hello, everyone. Again, I'm Patrick Dunn from the New Haven Pride Center and chair of the LGBTQ Health and Human Services Network. I just want to say for any person out in the community, and I say person because monkeypox truly can affect any person in Connecticut. If you are feeling concerned or feeling like you do not have the information that you need, please reach out to our organizations, please reach out to DPH so that we can not only fight the stigma around this disease, but also make sure that we don't come from a place of misinformation, because when we come from a place of misinformation, diseases spread. So I just want to say that we as the Health Network, Linda, myself, and many others around the state are excited to continue to work with DPH and the Commissioner and the Governor to ensure everyone in our community can have access to the vaccine that they need and want.
Thank you, Linda and Patrick, for those words. I'd like to take a moment now to introduce Tyler Booth, who's our Vice President and Chief Operating Officer of Intercommunity Healthcare. Thank you.
Good morning, everyone. Again, my name is Tyler Booth. I'd just like to echo some of the statements that were made before, the importance of having adequate information and to have access to the vaccine. At this point, what's being recommended is the vaccine would be administered to individuals who've had a recent contact or potential exposure. One way to figure out if that's something that you may be dealing with, the most telltale symptom is the monkeypox rash. If you are unsure if that's what you have, you can feel free to contact any healthcare provider, places such as Intercommunity. If you call our main number, which again is 860-569-5900, we'll be able to do a phone triage with you and potentially a telehealth visit to determine if in fact it does make sense for you to come in. And then we can schedule that appointment for you to receive that vaccine. As was said already, we are working closely with DPH and the governor's office and other folks because information is the way that we're going to be able to get ahead of this disease. Thank you.
Thank you, Tyler. And now, we are very honored to introduce to you now and to have with us here Governor Ned Lamont.
Well, thank you, Kim, and all the good folks here at Intercommunity and what you do. There's a little sense of deja vu. I know that. Looks like the federal government could declare a public health emergency regarding monkeypox in the very near future. New York City is the epicenter here in the United States. When New York City sneezes, Connecticut catches cold. Oh my God, here we go again. But they're also very different. First of all, I'm with Linda. Don't call it monkeypox. It has nothing to do with that name. And for people who are exhausted by COVID and what we had to do to get through that safely, and Connecticut got through it better than just about any other state, that name, I think, sends the wrong signal. You can call it, oh my God, not another pox, because I think there's a certain sense of fatigue out there. But this is very different. New York sneezes, we catch cold. No, this is not done. This is not aerosolized. It's not passed through the air. We're not wearing masks. It has nothing to do with this particular. This is close personal contact, often sexual contact between men. It's not like we can just go out and have mass testing centers like we did during the worst days of COVID, because in order for us to be able to test, you actually have to have that lesion. You have to have that rash. And at this point, if you have that lesion, if you have that rash, come right here. Come to Intercommunity. Call Manisha. We'll get you set up. We've got the testing capacity we need to test everybody that has those symptoms going forward. This is also back to the days of track and trace. It's a narrower group of people, much narrower group. We don't see this spreading wildly throughout the community for the reasons I just said. But that group, we want to make sure who you have been in close personal contact with. And if you have been in close personal contact and you were notified in terms of our contact tracing, come and get a vaccine. Get vaccinated right now. Those who are most at risk, we have the vaccines available. We got a much larger shipment coming over the next few days. We'll be able to take care of you. Right now, we're focused on those populations that have had the close personal contact with somebody who's been infected. We've got the vaccines necessary to take care of you, and we'll also have all the testing capacity we need. I'll just say, I know there's a certain air of exhaustion and a sense of deja vu, but Connecticut managed through the last pandemic better than just about any other state because we looked out for each other. We took it seriously. We didn't get extreme in terms of what we had to do. And I think you see now, I believe this will be a narrower population, less likely to be transmitted broadly, but be careful. And unlike 2.5 years ago, we have the tools in place to keep you safe and those you've been in close contact with. Take advantage of those tools. Thanks, everybody.
Thank you, everyone, for coming. We appreciate you being here. You can call, obviously, 211, or you can call Intercommunity at 860-569-5900. Please call before. We are not taking walk-ins at this time for this, and we appreciate everyone being here. Thank you again.
Any questions?
Any questions?
If you're a man
that identifies as gay or bisexual, can you be eligible for the vaccine, or do you have to be closely infected or close to somebody who's infected? Yeah.
So, just to make sure. Do you want that? Yeah. 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 So, right now, what we're expanding to as of Monday, and this is what the 15 sites are going to be able to do, is that if you are 18 and older, if you are a man who had sex with men and have had a contact in the last 14 days in terms of multiple contacts, that would be somebody who is going to be potentially eligible. So there's a screening criteria, and I'll ask Dr. Sosa if I think there's one other piece of that, or is that basically correct? Yeah, and as long as you're a Connecticut resident. I'm sorry, that's the part I missed. So as long as you're a Connecticut resident, 18 years of age and older, and you meet that criteria, you would be eligible for a vaccine.
But gay and bisexual men wouldn't be, what's the word I'm looking for, prioritized in this. Anybody that has had contact would be prioritized, right?
No, that's what I was saying to start, is that the first criteria is if you are a gay, bisexual man, somebody who has been had these exposures in the last 14 days, you would be prioritized. That's exactly the group that will be prioritized.
Commissioner, could you
Yes.
explain this? So in a skin-to-skin contact situation, is that for like an open wound type thing versus just like, touching of the arm or?
Right. So it's when we say skin to skin, it's skin to skin with the lesion. So, if you shake somebody's hand but they don't have anything on their hand, that should not be a way that you are infected. If somebody has no symptoms, they are not infectious. However, if somebody slept in a bed and had lesions throughout their body and slept on sheets, and you sleep in the same bed, that is a theoretical exposure that could transmit the virus.
Thank you. And then another question, how are cases determined, or how have they been determined so far?
Yeah. So we started with one lab, which was our state public health lab. We now have 5 commercial labs in addition that are testing. Again, remember, the testing is if you have a rash, that specific lesion needs to be opened, a swab is done of the liquid that's inside, that is what's sent to the lab. That test then gets reported to a database that we have. That database is then alerted to, us in DPH, local health as well. Local health gets that result, is able to then call the person who's infected. We need to make that contact to make sure that person's doing okay. They can be referred to a healthcare provider to be evaluated if they qualify for any of the medications that we have for treatment of monkeypox. That's for the case. Now, in that conversation with the case, they then identify contacts. And then the local health department is able to call the contacts to then be able to refer that patient to one of our 15 testing sites that we currently have, which again, I said may be expanded, but that is the way the process works to be able to get people identified. And anybody who's identified as a contact is then monitored for 21 days. Those patients are kept tabs of, did they get a vaccine within 4 days is most efficacious, but up to 14 days is still warranted. However, if you already have monkeypox, if you already have lesions, you are not qualified to receive the vaccine because now you are a case. So the goal is to try to get as many people as possible before they actually break out with a rash.
Thank you.
Follow up on that question, Doctor. How many vaccines does the state have used, and how can we access them in this case?
Okay, so the amount that we were allocated, so let me just find that exact number to tell you. So we were allocated on July 8th, 635 doses. On July 15th, we were allocated an additional 1143. We are expecting additional doses. So from that, that's 1,778 doses is what we were originally allocated. We are expecting an additional allocation. There are some doses, so on websites that are out there, they're reported as slightly higher numbers. We've alerted them that that is not correct in terms of what we were allocated. However, we did receive certain doses to vaccinate laboratory staff who were doing the testing, to vaccinate some of the initial contacts that before we were sort of even allocated any doses. So those are some of the additional doses that might be reported out there, but this is what our actual allocation was.
I think you said 28 cases since July 5th. Is that correct?
That's correct.
Is there any projection, or is that difficult to project on the numbers going forward?
It is difficult for us to project that. What we try to do is look at the slope of that curve in terms of where we're headed. And I think at this point, it is very challenging to predict. I think the good news is that we're still at 28. We're not in the hundreds. That is the good news. But I think we really monitor this every day to try to get a sense of that trajectory.
Pox viruses can be spread by if you're contact tracing, are you also reaching out to like public parties, events where a case has been detected, or are you just doing these person-to-person calls?
So there are different levels of contacts: a low-risk contact, an intermediate-risk contact, a high-risk contact. The high and intermediate risk contacts are the people that are being contacted to let them know whether, because those are the groups that might be eligible for a vaccine. And so in the contact tracing that's happening, that is who's being identified first. I think one of the key things to remember here is that when I mentioned that people who've been in planes next to somebody who had monkeypox, who we may have been alerted as a health department, so far throughout the country, there have been no cases of transmission in an airplane exposure like that, where somebody might be sitting next to somebody. We've been monitoring those patients over the last many weeks, where we've been alerted about cases that somebody may have been in a plane next to somebody else who had monkeypox. Secondly, healthcare worker exposures. Also, there have been no contacts as of now who have actually gotten monkeypox from an exposure. So, Dr. Sosa, anything further in terms of whether there's any additional contact tracing that we're doing in terms of respiratory type contacts?
But I think the focus is that for the people that are attending those large parties and having lots of partners, those are the focus that
Okay, so essentially what we are trying to do going forward is, as I mentioned, for people who are attending large parties where there may have been cases, but again, primarily focused where you may be having multiple either close contact exposures or sexual partners, because that's what we've seen even in the large party setting. Those are the people that are being focused on in terms of priority for getting vaccination. So if somebody is just at a party, and you may not be in a type of party where there's close contact or sexual contacts, those are not people that we are reaching out to in terms of contacts so far. The evidence does not suggest that that type of exposure is a high-risk exposure or even intermediate risk exposure for getting monkeypox.
What about like households? If you like cohabitate with somebody who has had an exposure, are you a high-risk exposure?
So if you live in the same household, if you share a bed, if you share towels, if you share clothing, if you've had skin-to-skin contact with somebody who is in your household, yes, you would be a high-risk exposure.
What's the administration doing just to make sure the prison system is safe for both inmates, staff, and the surrounding community? We've been told conditions aren't safe, broken AC systems, inadequate on-site health care. So what's being done to protect folks working and living inside?
The question is, what's being done to protect inmates at our correctional facilities, not to mention the correctional officers themselves. It's a congregate setting. Look, first of all, during COVID, we took this very seriously. We quarantined people as best we could. We, certainly made masks available. We certainly made vaccines available. And compared to a lot of other states where you saw, some real super spreader events. We, thank God, did not see that in our correctional facilities. It's still something we monitor very carefully right now. Are you asking also about monkeypox, or?
Also just about like the conditions inside currently, broken AC, just the concerns about healthcare, all that. So all that actually as well.
Yeah, the biggest worry that I have right now is nurses and nursing staff in our correctional facilities. And we've obviously incented, accelerated programs, giving a bonus money to get more nurses into those correctional facilities for reasons you can understand. You know, secondly, we do have a lot of corrections officers doing double shifts, and that's no fair to them, and that's why we're prioritizing getting more people hired as quickly as we can in those facilities. They're doing everything they can to keep people safe.
Thank you.
Thanks. Thanks, everybody.
We're going to do off topics in a little bit.